medication and side effects. If you work for an agency licensed by DBHDS, you will complete training and testing in the required medication administration procedures before administering medications. This is a course approved by the Virginia Board of Nursing. The safe and accurate administration of medications is one of the most important duties you will perform as a DSP. Medication errors can cause great harm or even death. Therefore, it is essential that, when giving either prescription or over-the-counter medications, you follow the procedures and safeguards you will be taught in this required course. Some people take multiple daily medications. All medications can have side effects, some of which can be harmful. Side effects may indicate that the medication dosage or type may need to change. In addition, people on more than one medication may experience symptoms related to the interactions of their medications. As a DSP, you should become familiar with how medications affect the people you support. Side effects are sent by the dispensing pharmacy and are maintained in each person's medication administration record, MAR. In addition to the known side effects, the changes in daily behavior and patterns described above may be a sign of a negative drug reaction. Always report a concern. Important point. As someone who spends a lot of time with people using supports, you or your supervisor will ensure that the doctor has all the available information to decide if the prescribed medications are having the desired effect or a change is needed. It is a good practice to have all prescribed medications filled at one pharmacy to prevent the risk of a negative reaction between two different medications. Pharmacists can review all medications when a new medication is prescribed, since different doctors can prescribe medications for the same person. Emergency care. It is best that all staff receive training in first aid and cardiopulmonary resuscitation, CPR, prior to supporting people alone. This will enable you to react appropriately and possibly to save someone's life while medical care is on the way. During a health or medical emergency, for example, if a person stops breathing, has serious bleeding, becomes unconscious, or has other serious symptoms, be sure to follow your agency's emergency procedures, including contacting administrative staff. Important point. It goes without saying that any condition which would be considered an emergency if it happened to a member of your family is also an emergency if it occurs to a person you support. Call 911 at the first sign of a medical emergency. Other health concerns. In addition to the potential for illness and injury, you may find yourself supporting people with ongoing health conditions including, but not limited to, seizures, diabetes, Alzheimer's, sleep apnea, arthritis, heart disease, visual or hearing impairments, food or drug allergies, and concerns affecting their freedom of movement. All DSP are responsible for being aware of and knowledgeable about the signs and symptoms of the health conditions of those you support. Each staff member should also be aware of mobility or freedom of movement issues. Information regarding these concerns should be available along with ways to support someone who is at risk of falling in their daily routine. These supports should be included in the instructions as part of their plan for supports. Important point. It is essential that DSP get to know the people they support. Being observant, responsive and attentive to medical needs is the key to assuring health, safety and a good quality of life. Exercise. Along with regular medical care and good nutrition, exercise is another important element for a healthy life. Many people have never experienced a regular exercise program. Though they may face some physical challenges, there are a variety of activities designed for older adults and people with disabilities. Exercise can be fun and exciting. We all benefit from moving more, so explore physical activities the person enjoys doing and find ways to include in their daily routine. Most major health organizations recommend at least 30 minutes of exercise most days of the week, using a combination of cardiovascular exercise, walking, swimming, and/or aerobics, and resistance exercise, weights. There are many ways to incorporate exercise into a daily routine that can be creative and interesting. Some ideas are: visit a nearby school and walk around the track. Find a local park with walking trails and other attractions and do a combination of walking and sightseeing. Plant and maintain a small garden. Grocery shop, pushing the cart and reaching for items from shelves. Dance. Join a gym and take classes or use the equipment. Do household chores together while listening to music to keep moving. Always check with the person's medical professional before starting an exercise program. Assistive technology. Assistive technology refers to any item, device, piece of equipment, or set of products that is used to maintain or improve the abilities. Assistive technology allows us to function with more independence, provides more choices, and results in an increased sense of confidence. Assistive technology devices may range from simple and inexpensive everyday items to complex computer systems. Some devices are not designed just for people with disabilities, they can make life easier for anyone. Examples of assistive technology that enable people to carry out daily activities include eating and cooking utensils fitted with oversized handles for easier gripping, shower benches and bathtub lifts, wheelchair ramps, programmable telephones, and picture boards. There are also assistive technology communication devices that provide assistance when people who do not communicate using words. The device can include speech, gestures, sign language, symbols, synthesized speech, dedicated communications aids, or microcomputers. As a DSP, learn how to properly use any specialized equipment so that you can provide assistance as needed. Assistive technology benefits all of us as we age. It may be a key element in helping people remain in their home and community as they age. It also helps maintain as much independence as possible as physical and cognitive abilities change due to the aging process. If someone you support could benefit from any of the devices mentioned above or other equipment, mention this to your supervisor, the person's coordinator, or family member. It is possible that the needed item may be available through Medicaid or Medicare. Important health conditions for people with DD. There are 8 health issues that are often overlooked and need to be more carefully monitored. These conditions can progress rapidly and result in bigger problems, even death. They include: 1. Skin care, pressure sores, skin breakdown. 2. Aspiration pneumonia. 3. Falls. 4. Urinary tract infections. 5. Dehydration. 6. Constipation and bowel obstruction. 7. Sepsis. 8. Seizures. General process for you to follow if changes in the body are noted. Call 911 if there is an emergency. Immediately talk with your supervisor about the change you are observing. Follow all agency or program policies and procedures for contacting medical professionals, reporting medical issues, and documenting medical conditions. Skin care. Healthy skin aids in regulating body temperature, protecting internal organs from injury and environmental elements, and protecting against infection. Signs and symptoms of possible skin problems include, but are not limited to: unusual or abnormal color, pale, pink, red, or bluish. Rashes, cuts, open sores, raised bumps, blisters, bruises. Changes in skin temperature, such as moist, hot, or cool to the touch, and parasites. Your role if signs or symptoms are noted. Whenever skin issues are noted, medical staff should be notified immediately and the reporting and documentation procedures for your program followed. Be sure to report any signs of skin breakdown or pressure sores or ulcers immediately to your supervisor. Pressure sores are areas of skin damage resulting from a lack of blood flow due to pressure, friction, or pulling on the skin that gets worse over time, blisters, pain, itching, and crater-like appearance. Click on the next link to continue the training part 3.